Good afternoon, everybody. We are live. I'm handing over
Okay.
the session to Dr. Sureshri.
Good afternoon all. We welcome you all, our current students, to the second webinar of Alumni Engagement Program for the academic year 2021-2022. We have Dr. Ashlesha Dixit Gokhale with us, and she'll be speaking on PT licensing at USA and overview. So to introduce our alumni guest today, I request one of the founding pillars of Sancheti College of Physiotherapy, Dr. Nilima Bedekar ma'am. Nilima ma'am is currently HOD and professor and HOD of Musculoskeletal Physiotherapy Department. She's the vice principal, and very, very proudly, we all would like to congratulate ma'am for recently receiving the Lifetime Achievement and Orator Award from the Nagpur Association for the Rehabilitation of Children and Adults with Orthopaedic and other disabilities, and commonly known as the NARCOD. So congratulations, ma'am, and please introduce our alumni guest, resource person today.
Yes, lovely. Great introduction. And it's a very proud moment to introduce Ashlesha today. She is alumni 2007-2012 batch. So she passed from here, graduated 2012 and did her master's, and then now in US. So Ashlesha, it's really an honor to introduce you. Ashlesha is a licensed physiotherapist in US, and she has worked in various settings out there. She started licensing process in 2015, and now she has license from 5 states in US. And the lack of resources and guidance in this journey gave her the motivation to help students, with this vision in mind. She's been conducting webinars and one-to-one sessions for prospective students and helping them for acquiring license, because it's the most needed thing when you go out there. Even after doing a master's degree, there are so many procedures. I am not aware, where she will enlighten us on how to do it and how to go through this process, which is so stressful, I can imagine, because unless you have the license, you just can't do anything out there. Ashlesha has a very good academic background, but at the same time, she has actively participated in all extracurricular activities which were arranged. So she always was in the front students who would like to do so many other stuff. So we welcome you, Ashlesha. And you could start addressing our students. It's in the midnight. She's waking up very early in the morning. So thank you for that also. Yes. So please start your talk.
Congratulations to begin with, and thank you so much for your kind words. I would like to welcome all the listeners today. So as ma'am said that I completed my bachelor's from Sancheti Institute College of Physiotherapy in 2012. And then I also did my master's and came to US in 2015 to join my husband here. I also started my procedure in the same year. And, I took a little bit of a time, like more than 1.5 years, and went through a little bit of a grind to get my first license in 2017 to work in Delaware. For last 6 years, I have been talking to friends, students, some acquaintances, some colleagues. And what I realized was everybody goes through the same feeling of being overwhelmed, confused, they don't know what to do. And I realized that, okay, maybe now there is a need to pass on the information that I have gathered in last few years to those people who are interested to get licensed in US and start their journey in licensing after they come here. So that's why today's session, and I welcome you all again. I'll start sharing my screen.
Yes, please. Yeah, that will be great.
Am I good visible? Can I start? Is that okay?
Yes.
So today's agenda is going to be to go over the overview of the licensing process and to come to know about few acronyms, terms and their meaning and their role in this process, and where and how to start the process overall. So being in India, not being in India, even if you're here, You must be having so many questions, like everybody has. Where to start this process, how to start this process, what are the steps, what preparation should I do while I'm in India, and so many more. And it's a good sign if you have questions, because when you have questions, you tend to ask them and you tend to get more information on that. So it's a very good sign if you have questions, and don't worry, I'll be going over and covering many of these questions today. Okay. So the path for this process is going to be something like this. There are many steps involved in this process. And unfortunately, it's not like, okay, step 1 is done, now I'm on step 2, step 2 is done, I'm on step 3. Unfortunately, it does not work that way. There are many steps and they go hand in hand. There are many things which are going on simultaneously. So my only advice would be start early and keep yourself organized. So you can make a list of your own tasks and make sure that, okay, task A is being taken care of. Now I can move to task B while task A is in the process. So you kind of have to multitask when you're in this process, and you will get it. Once you jump in this process, you will get it. So don't worry about it. So before we go into details of what licensing looks like, I'm just going to give you overview. So when you decide to get licensed as a PT in US, the first thing is there are some documents that come from your university in India. Those documents are sent to USA to one agency which is named as FCCPT. FCCPT evaluates your documents and they give you reports saying, okay, this is okay. Once they give you the report saying everything is okay, you will receive the clearance from different company, which is FSBPT. That clearance is for you to go ahead and schedule your NPTE, that is National Physical Therapy Examination, that is license examination. Once you get the clearance, you can schedule your license exam, and then you are licensed in US. And how I wish it was so easy and simple. So before we go into details of this process, let's just go over some terms and what their meaning is. So I mentioned FCCPT. It basically, their full form is Foreign Credentialing Commission on Physical Therapy. This is an agency in USA, located in Virginia, US. Okay. What they do is they do credentialing. And what does it mean? Credentialing is basically evaluating your India education to see if it matches with USA standards of education. And that's what they do. This is a very, very important step in licensing. Okay, FCCPT evaluation is the most important step. Okay. The other term I mentioned was FSBPT. FSBPT is Federation of State Board of Physical Therapy. It's a sister company of FCCPT, and it works at a state level. You know that there are 50 states in the United States, so FSBPT works at the state level. When you go on the FSBPT website and kind of just go over their website, they will give you a list of all the 50 states, their information, their email address, their website, their contact number, website information. So whenever you want to choose a state, or you want to know about different rules or different criteria mentioned by specific state, just go on FCCPT website, look for the state, go on their website, and they will give you specific requirements, eligibility requirements for foreign educated PTs. This is the term that will come across many times, foreign educated PT. Okay, so this is what FSBPT gives you information on. But another important role of FSBPT is when you reach the step when you are ready to schedule your license examination, NPTE examination, that goes through FSBPT. Okay, so that's another major role of FSBPT. These license examination dates are declared in so much in advance on FSBPT website that they already have dates for 2022 and 2023. So we are in 2021 right now, and they already have dates out for next 2 years. And when you go there, you will see a little bit gist of what they mean. Like, test date, as you see here, there are 4 different dates in 2022 and 4 in 23 as well. So they say that, okay, test date is going to be this one, registration is going to be December 22nd, approval is, so, you get the good idea about what are the deadlines and what is the exam date. So it gives you enough time to prepare mentally that, okay, I can shoot for maybe this date in 2022. And so this is very helpful. It gives you enough time to decide, like, which date you want to give exam on. Few slides back, I mentioned that documents come from your school and they get evaluated in FCCPT with FCCPT. So you must be thinking that, okay, they will evaluate my education, fine, but what do I need to do from my end? So first things first, simple. First, open your file with FCCPT. Now, how you can open that file? We are just going to go over a short video of it, okay? Okay, so just Google FCCPT. Let me just start on the So when you just Google FCCPT, you will see this. Just go on their homepage. This is how their homepage looks like. They give you many options like new applicants learn more, new applicants apply now, next steps, or if you're a returning applicant, then log into my profile. So being the first time applicant, you're going to hit on apply now. Once you hit apply now, they will show you list of services that FCCPT offers. Type 1 review, educational credential review, New York credential verification, PT assistant educational equivalency review, and so on. So this New York credential verification is specifically for New York State. They have a different service, okay? Now, what do the services mean, or which service is applicable to whom is a whole other topic of discussion. I don't want to bombard you today with all that information because it's a lot. Let's take an example of a very common type of service that people opt for, and that's the type 1 review. You see here it's a type 1 review. And why I say it's a very common type of service, because when you do type 1 review, they give you type 1 certificate, which you need to submit if you wish to get H1B, that is work visa in future, to start practicing in US, okay? So that's why type 1 is the most common type of service that people opt for. Now, if you decide that you want to do type 1 review, you are just going to hit on select. Now, FCCPT will give you list of things or list of documents that you need to keep ready in order to fill out their application. FCCPT no more takes paper applications, it's all online. So they say that, your educational records, your higher education records, included report is basically the state that you want to eventually start practicing in. They will also ask you for the license history. Being a first-time applicant, you do not have license history. Don't worry about it, okay? So once you have all these documents ready with you, just handy with you, you are just going to say, I have all the records ready and I'm ready to get started. Once you hit let's get started, FCCPT will lead you to the first page of the application. And there are many pages like this, and they all are self-explanatory. Okay, they will start from general information, then they will probably go to educational information and all that. So all those pages are self-explanatory, and once you fill out these application pages, and once you make the payment, then FCCPT will give you a file number. Okay, once the payment is through, your file is open with FCCPT. Now your application is in and your file is open with FCCPT. Now FCCPT gives you a file number. I think they email you the file number, okay? This file number is extremely important. Why? Because if you have any questions, you call FCCPT, the first thing that they will ask you is, okay, what is your file number? When you want to log back into your profile, the first thing that they will ask you while logging in is, what's your file number? Your last name, your country of birth, and your date of birth. So you have to save this number, write it, note it, memorize it, whatever works for you, but you need to have it for long term. Okay. So your file is open, you have a file number. Now what's next is, now FCCPT needs some documents from you as an applicant and few documents from your university. Okay. The list of documents, what they need, they are displayed under your profile. So once you log into your profile, they will show you a list of documents and how it looks like, something like this. So let's take an example here. If you have chosen for type 1 review and you log back into your profile using your file number and other details, this is how the homepage looks like. They kind of give you an idea of what is going on with your application. So they tell you the type of service that you have opted for. Here it's type 1 review. What's the status of your service? It's pending, done, or they tell you the status. Then they also tell you the service date, like when the service has started, if they have started reviewing your documents or not, and how long the service will take to get completed. Now here, as you see, these green boxes, step 1 and step 2. The green boxes are the boxes which are the steps that you have already completed. The blue box says step 3 is you are at right now. And the gray boxes, step 4 and 5, are the steps that you still have to go through, that they're yet pending. Okay. And this is how they will show you list of documents here. They need PT diploma, transcript, syllabus, some forms, TOEFL, and everything. They also show you the status of your documents, like if they have received them, if they have not received them, and everything. So when you log back into your profile, FCCPT gives you a good idea like what is going on. Okay. As I mentioned that FCCPT now needs documents from you as an applicant and from your university. Okay. So let's talk about the documents that they need from you. The first is attestation form of PT credit and evaluation. Now this form is available under your FCCPT profile. When you log in, there is a separate section which is mentioned as documents library. All the forms that they need, they are listed in this documents library. So you go there, just download this form. This form is basically, I think you are giving them permission to start evaluating or evaluate your education. So you need to fill out the details. I think they ask for your picture and everything. You need to get it notarized. Okay. So print this form out, download the form, print it out, fill out all the information, get it notarized, and then you send it to FCCPT from your end. So you courier it to FCCPT. Okay. Now, FCCPT also needs documents from your university. So let's go over what documents they need from your school. Okay. First is transcripts. So if you have completed your bachelor's, master's, just contact your university. Let's take an example of MUHS here. Okay. So contact MUHS, tell them that I need my transcripts from a bachelor's and master's or bachelor's. And they will tell you that what's the procedure is, how you can get the transcripts. Similarly, get the syllabus from MUHS. Now, when I applied for the syllabus copy, they had just asked me for a letter, like saying that I'm applying for syllabus for my UG and PG. I just need one copy. They asked you number of copies. You can send those copies at this and this address. And I'm also sending you the DD of the amount that you have requested. So they tell you that what you need to do in order to get this documents with you. Okay. So you need to get your transcripts, your syllabus ready from the university. They also need mark sheets and degree certificates from MUHS. They need to be attested from MUHS. MUHS is also aware of this process, like, attestation of mark sheets and degree certificates. So just let them know that I need my mark sheets and my degree certificates attested, what I need to do. They will tell you the procedure, you can just apply for it. Now you have your transcript, syllabus, mark sheets, and degree certificates ready. Okay. What FCCPT needs is academic verification form, you can see it here, and clinical internship form. So these forms are to be filled by MUHS person. So what you will do is basically download these forms, keep it ready. There might be some portion that you need to fill out from your end. The other portion goes to MUHS to be filled out. So when you have your transcript, syllabus, mark sheets, degree certificates, and these two forms ready, you just make a package of it. Just write a letter to MUHS saying that I'm a student of MUHS, I'm an ex-student of MUHS, and I am in the process of getting FCCPT evaluation done. This is what my file number is. I'm sending you all these documents along with these two forms. If you can fill those forms out for me and send this to FCCPT, that would be great. Now, MUHS is aware of FCCPT evaluations and USA licensure process. So they know that FCCPT needs few forms from MUHS. Trust me, I have had a friend like junior that she told me that MUHS called her to tell her that I have not received one form for you which we are supposed to fill out. So they know it very well that they need to fill out the forms. So you just need to tell them that I'm in the procedure and I'm sending you all these documents. And once you are done filling out this form, I'm sending whatever the fees they request you. So I'm sending the DD in or whatever other method they request. And I'm sending all this. Can you please send this package to FCCPT at this address? Be rest assured that a new HS will be able to help you through this. They know it, they should be able to help you. Now, when you're in this process, you will come across this term as license verification. Okay. FCCPT demands or requires license verification from the country of your education. Now, India does not give any licenses, paper licenses, and FCCPT knows this. So, in your profile under the document list, if you see license verification, it's just a matter of call or an email to FCCPT and tell them, I'm from India, I do not have a paper license because India does not give paper licenses. And they will be like, okay, we'll just take this requirement off of your list because they know it. So don't get bothered by this license verification term. It's not applicable for us PTs who are from India. Okay. Now, FCCPT, like documents from you and documents from your university are sent to FCCPT, are couriered to FCCPT. Now, FCCPT has your documents. Okay. Once FCCPT receives these documents, then they will start your educational review. As I mentioned, they'll start their credentialing. They will start the educational review from the documents that are being sent to them. Now, let's take a pause here. Okay. FCCPT will evaluate your education. You have taken all the steps from your end. But have you thought about it that, okay, they will evaluate my education on what basis, on what criteria? May I know about it? Yes, you certainly can. So FCCPT and FSBPT has come together they have developed a tool which they call as coursework tool, CWT. Now, there are many CWTs that they have developed, starting from CWT1 to recent one, CWT6. So what is CWT? It's standardized method to evaluate education equivalence of foreign papers. Okay, what it is. So basically, coursework tool defines the criteria that FCCPT needs to follow while evaluating your education. Those criteria are divided into two categories, general education and professional education. Okay. They call, when they're going over your transcripts, as I said that there are general and professional education. They evaluate your hours and they call them as credits. So they have their different method of calculating credits. Okay. So the requirement is something like this. They need, so we'll go over one document here. Okay. So if you just Google FSBPT CWT6, you will find a PDF. This is how it looks like. Okay, it's a coursework tool for foreign educated physical therapists. So as I told you, they give you criteria about general education and professional education. So let's start with the general education. What they need, what they tell you in general education is they have given 5 categories in general education, like communication and humanities, physical science, biological science, social and behavioral science, mathematics, and they have given few subjects under this category. So what they require from US, they basically tell you that while we are evaluating your transcripts, while we are evaluating your hours, we will go over these categories which are defined in the CWT6, and we will try to find what we need is enough hours or enough credits in at least one subject from each of the 5 categories. I repeat, they need few hours, enough hours and enough credits in at least one subject from each of the 5 categories. Okay, this is general education. Similarly, in professional education, they have come up with, I think, 7 categories. Basic health science, medical science, examination, evaluation, plan of care implementation, clinical education, and related professional coursework. And they have again described few subjects or few subdivisions, subcategories under these main 7 categories. So when they evaluate your professional education, they tell you that we need certain credits in professional education as well. Okay. Now, as I said, general and professional. So in general, enough hours in at least one subject from each of the 5 categories described under general education. But there are some states like Pennsylvania, Georgia, Massachusetts, and few more. They kind of don't agree with this. They say that, okay, we are not okay with enough hours in one subject from each category. What we need is a solid number. We need 60 credits from the applicant. If you have 60 credits, then we are okay. But we don't agree to this. We don't agree to one subject from each category thing. And there are 7 states like that. My entire education is from NUHS, bachelor's and master's. And I know that we lack general credits when they go over our transcripts. So if you happen to be in one of those 7 states, then you have to be aware of this credit requirement, okay, general credit requirement. Now in professional education, their demand is one simple number, 210 professional credits or clinical hours, professional credits basically. So it's not hours, they calculate hours into credits according to their methods and they need 210 credits. Okay. When they evaluate your transcripts, when they evaluate your hours, this is how this looks like. So I want you to go over. So they have this evaluation checklist. Okay, so they will go over general education. While they're evaluating your transcripts, if they find something in English or anything in foreign language, they will put those hours here. Okay. Wherever they find any evidence that, okay, now biology, anatomy, physiology, if they find enough hours, whatever they find from the transcripts, they will put it in front of those subjects, mathematics and all that. Same, and then when they evaluate the general education, they will write total number of general education credits are so and so here. Okay. Now, same with the professional education. They will go over these categories. They will find wherever you have enough hours, or wherever you have hours, even if they're enough or not, doesn't matter. Wherever they find hours, they will put it in front of that subject. And in the end, they will give you the total number of hours that you have gained in professional education as well. Here. Now, so basically, they are evaluating your transcripts. They have received your documents. They will start your education review, and then they will follow CWT 6 criteria. So CWT 6 criteria is for those students who are graduated 2017 and onwards. Okay, so right now the latest one is CWT 6, which is in action. Okay, so they will start reviewing your transcripts. They will follow CWT 6. And if they find enough number of general education hours according to your state requirement and professional education hours, then they will send you the report saying that everything looks okay and your India education, India PT education is at par with USA PT education. They will send you the report saying that, okay, everything looks okay. But what if you do not have enough hours in professional or general education? What happens? Then FCCPT will send you deficiency. They will send you the report saying that we found some areas which are deficient, like we could not find enough credits or enough hours in following areas. For example, plan of care implementation in professional education, we did not find that. Wound management, or in general education, we do not have enough credits. We could not find enough subjects or enough credits in the categories. So they send you deficiencies and they list down all the areas where they could not find enough hours. What you need to do about it? As an applicant, you need to start giving exams to fulfill those hours. Now, there are different resources available to get these exams done. For general education, the subjects and the exams are not related to PT. So I understand that sometimes it might just get a little boring, but I'm like, it's their protocol. So I understand if that happens. but you will have to complete those general education deficiencies, professional education deficiencies, whatever they send you. Once you are done, fulfilling the deficiencies, once you're done giving your exam, you can just get back to FSBPT saying that, hey, I'm done with all the exams and I think my scores are okay now. And they receive all the scores directly. You just need to opt for it when you give the exam. It's a very simple process. So they receive the scores and you tell them that I think I have done, I have fulfilled my deficiencies, and can you re-evaluate my education now? When they re-evaluate, when they find that, okay, there are enough hours now, everything looks okay, the deficiencies, there are no more deficiencies, they will send you a report to you saying that your PT education is at par with USA education, USA PT education. That report is also sent to FSBPT. So the report is sent to you and report is sent to FSBPT. Once FSBPT receives that report, they will send you ATT, authorization to test. Once you get that letter, you are good to schedule for your NPTE, that is licensure examination. All the details, all the instructions are mentioned on that ATT letter. Meanwhile, okay, once you receive your report, you also have to make sure that your state where you want to decide or where you want to get licensed as also requires few documents from you, but they are very simple. So you need to take care of that as well, side by side. Once you receive ATT from FSBPT, then you're good to schedule your license examination. Once you schedule the examination, once you clear that, you're licensed. You're licensed in US to be able to practice as a physical therapist. So whatever we talked from, since some time back, we'll just go over it super quick. Once you decide to start your process, or once you decide to start get licensed as a PT in USA, you need some documents from you and from your school. Those documents come to United States, to FCCPT. FCCPT will go over your clinical transcripts, your other documents, your educational records, following CWT 6 criteria. Okay, if they find enough hours, they will send you the OK report. Everything looks okay. If they do not find enough hours and credits, they will send you the report. It does not look okay. Okay, so you have deficiencies. If you have deficiencies, just give extra exams to complete those deficiencies. Okay, once you receive the report saying that, okay, you're okay to go ahead, that report is being sent to FSBPT. It will send you ATT, that is authorization to test letter. Once you get that, you can schedule your license exam, and then you're licensed in US. Now you must be thinking, what are the good steps to start with? If you have completed your bachelor's, master's, I think it's a good time that you get in, and if your convocation is done, so that you can get your degree certificate. So I think it's a good time to start collecting documents from MUHS, because it takes time. Okay, so you need to have enough time for them to give you the document. It's a good time if you have completed bachelor's and master's. It's a good time to get in touch with MUHS and start collecting your transcripts, syllabus, degree certificates, and mark sheets, sets, and everything. Side by side, when you know that, okay, my documents are in process, you can also open your file with FCCPT. Now remember, FCCPT has 1 year rule, meaning if FCCPT does not receive your documents listed under your profile within 1 year, they will close your file temporarily. Then you will have to again pay the reactivation charges and ask them to reactivate your profile or reactivate your file. So remember that, there is a 1 year rule to send documents in. You can also start preparing for TOEFL. TOEFL is only valid, TOEFL scores are only valid for 2 years. So when I say that, on TOEFL website, your scores will be available only for 2 years. So even if you want to send those scores after 2 years to FCCPT, they won't be available. So you want to transfer them as soon as you give TOEFL, because once you send your scores to FCCPT are good with those scores for 5 years. Okay, but TOEFL gives you access to those scores only for 2 years. All right, so plan accordingly. You also want to decide which state you want to be in, which state you want to reside in, which state you want to get licensed in. Sometimes that decision is easy. Some people have okay, my husband is in this state. I have a family in this state. Okay, my university for my higher education, for my master's is in this state. So I'm going to get licensed in those, the respective states. So sometimes that decision is dependent on that. And it's okay, it's completely okay. Now remember, New York is the state which is easiest to get licensed in. But it's also the state which is most difficult if you want to transfer your license from New York to some other state. And why I'm saying that is New York being the easiest state, they ask you hardly for anything. And when for some reason, if you want to move out of New York, most of the other states will ask you something more than that New York did not ask you for. So imagine the situation if you are licensed in New York, if you start working there, and now you have to move to the other state, and the state that you want to be in is asking for some other credits or for other documents or examinations, which New York doesn't ask for usually, then you have to invest more time to give those examinations. So remember this fact very well, okay? Now, Dr. Suroshri, I think if anybody has questions, we can take those at this point.
Yes, we do have some questions from our audience. That is one of the fourth year students would like to know, she's exam going right now, that good afternoon, ma'am. For license, do we need degrees from those states or countries and also history of job there, etc.? Or MPT degree from India is fine? This is her first question.
Did you mean a master's degree from India? Is that what you said?
Yes, master's degree from India like yours. And she's also asking how the credits for professional section are calculated. So are these two different questions or is it a single question?
I think these are two different questions.
Okay.
So the first question is, if I'm getting it right, do you need to, as an applicant, do you need to take education in USA? Higher education in order to
or history of job, as in do you have to work there?
So let's start with history of job. Okay, you do not need history of job in US because you will not be able to start practicing in US unless and until you have your license. So it's simple. You do not need a history of job in US. If you're talking about history of job in India, sometimes, like if you have a long history of job in India, what they do is they get certain paperwork from your employer, so that if you're lacking credits, they can probably pull out few clinical hours from your job history. But that also needs to be good enough, like 2 months of job experience before you come to US for your master's. I don't think so it's going to help. So if somebody's working for many years, that's helpful. So that's about the job history. About the master's. So I want to highlight this point. Till few years back, FSBPT was evaluating education just on the bachelor's degree as well. Now what they need is they need master's degree. What happens is, so earlier the thing was people will come here, people would come to US, do their masters in US, and while they are doing their program, master's program, they would evaluate, they'll start the FSBPT process because it was getting evaluated on bachelor's degree. Recently, like very recently, a month back, I came to know about this new rule that they need masters, and this rule has been changed recently. Okay, very recently, maybe in a year or so, or maybe just very recently. So now what they tell you is you can have MPTE degree from India, you can have transitional DPT degree from US, that will be considered, or if you do your master's from USA, then it's good. They appreciate that. The thing is, if you are doing your master's from USA, you can start the process when you are done with your school here. That sometimes is very time consuming because with the visa situation, with the F1 student visa, the extension that they get to work here as a student, that's very time critical, that's very time sensitive. So to answer this question, yes, you do need a master's degree. Is master's degree from India okay? Yes, it is okay. Because when I came in, I had master's degree, so I never faced this problem. I have had friends like Nilima ma'am and Dr. Suroshri, you must be aware, Sakina, Neha, Amarnani, they also did evaluations sometime when I did it. And few of them were okay with bachelor's degree, but now it's not the case. They need master's degree. From India is okay, and from USA, well, and they appreciate that. But I would also say that I'm going to double check this with a couple of students because I have come across one student who is in the process, and she got a response from FSBPT saying that we cannot complete your evaluation unless you submit your higher education records, and that's why she was in a little bit of a trouble there. But yes, master's degree is required from India or from.
And then she asked how the credits for professional sections are calculated. Can you please give example of courses to cover deficiencies in professional aspects?
Okay, so what I know of is in CWT 6, because sometimes what they do is, according to state, like state you want to practice and the year of your graduation, they will apply CWT accordingly. Like I was graduated with my master's in 2015. That time CWT 6 was not in action. So they were, I mean, it was in action, but it was in process to be implemented in 2017 and onwards. So they applied CWT 5 for me. Now the criteria in those are a little bit different than CWT 6. I did not get any professional queries, okay, but I did get general credits deficiencies. In CWT 6, if we go over professional education, sometimes what people get is wound management. That's one of the queries. Plan of care implementation is one of the queries. If I'm not wrong, they also are asking for traction evidence. Like they are not able to find traction hours in the transcripts. So that's one of the queries. Now, how they calculate your hours, your credits is really their method. Like I don't think so they disclose that. It's just that they transfer it from hours to credits. So I'm not aware of how they do. But they mentioned, like I show the checklist, they will show you what are things are there. They will asterisk few things and they will write a note that, okay, we did not find enough evidence here. But I'm definitely aware of plan of care, wound management, and traction. They do require this.
So, Dr. Ashlesha,
what they are sharing with others about traction and things. So
Sorry,
they are the traction students are sharing with each other. The PPT for traction with ours. That's what they said. That they could help saying these work for traction. And they had shared with each other. We were sorted by each other, giving that I shared this and they got through.
Sorry, I could not hear.
I'm not audible, right? Right. Okay, go ahead. I feel again there is a connectivity problem out here. Continue.
But yes, when I came to know about this traction query for the first time, I was like, why do you need separate hours in traction? But it's very unpredictable. Sometimes people from MUHs, like, two people, like I never got any queries, but somebody from Somanya, who is CWT 6 applicant, she got some queries. When they had to evaluate my education, they gave me some different queries. So it really depends on, your transcripts and which year, what course you have taken and everything. So yeah, but general education, I'm very well aware that they do send MUH students queries about general education.
So what will be your tip for our current students to work from now onwards on the general aspects of credits so that they have as less deficiencies as possible?
Usually, what people do is that they have to cover their general deficiencies after they come to US. So there are many resources available. Some are online. Some, I think there is St. Augustine University. Then there is something with the Brenton or something like that. And CLEP is the college level examination, credits. So CLEP is another type of examination that people usually opt for. Now, FSBPT also entertains, when I was doing my queries or my general education, I could do all 60 or all 30 through CLEP that time in 2015-16. But now they say that, okay, once you're starting your procedure, you can take few credits from this source, few credits from this source. If those courses are approved or not, they will tell you about it. If you hire a consultant, they will tell you about it. Okay, this is approved and you go ahead. But usually I have not seen anybody doing any general credits from India. Actually, I had come across certain universities, I think Indira Gandhi University, if I'm not wrong, sometimes they offer, but again, I will not say that confidently because in my acquaintance and people who I have spoken to, everybody has done general credits when they are here. And those exams are really, Dr. Surgery, are so quick that you study for 1 week, just give online exam or just go to the center, give an hour exam, you have your scores and you're out. Because they're not PT related.
Okay.
So students can definitely find out if the universities in India that offer general credits, they definitely can find out, but I have not come across anybody who has done it from India.
Okay. So someone, so I think ma'am wishes to know that, is there any way you can get your credentials verified before you reach the US?
Oh, traction PPT was shared from colleagues who got the license. Yes, I told you that traction, I don't know, they asked this query. No idea. So before reaching US, do you get credentials verified? You can. For example, if I have done with my master's and I have some time to come to US, I can start my procedure while I'm in India. I can open my file, I can start sending my documents, because most of the documents will come from MUHS to FCCB. So anyway, it doesn't matter I'm in India or I'm in US. So basically, it's more like majority of the students who get licensed are more like, we will come to US, we are doing our higher education, and meanwhile we'll do this procedure. There are hardly few, like I have done, like I came here after I got married. So I had time. So I did it after I came here. I did not have any visa restrictions or things about like that to get worried about. But if you're in India, if you still have some time to come to US, and if you're done with your master's, you can start sending in your documents and start verifying your credentials. Yes.
Perfect. Great. So I guess that's all from our end. And like you promised, you gave an amazing overview about PT licensing. And I'm sure that we'll take it ahead and kind of, as discussed before with you, we will take one step at a time and we'll kind of make PT licensing way easier for our current students who pursue to work at US. So thank you so much, Ashlesha.
I just wanted to share my quick information with our listeners and audience today.
Sure, definitely.
That in case they want to reach out. So I just want to give a quick overview that we could not cover few things today because it's on purpose, honestly. Because
I can understand.
Yeah. Yes, it will be too much for them to
Yes. This was just app thing, They need to go into the details, which state and things like that, because it will change.
How is it evaluated? How long does it take each service, or which service is applicable to whom?
Yes.
There are different scenarios. Like I said, that some come as a student, some come after getting married, and how can you fulfill your deficiencies or approximate timelines and fee structure? I can cover that in a separate webinar. If our audience is interested, they can coordinate with me, and I'll be more than happy to help everybody and give information on that. In case our audience want to reach me out with any questions or anything related to PT licensing, just reach me at ptlicensingusa@gmail.com, and I'll be more than happy to answer your questions and more than happy to help you the best I can. If I do not know any information, I will talk to people or just try and find it out for you. But don't hesitate to ask any questions with licensing, because I have been in that spot where I was like, okay, am I asking something stupid? But you need to ask it, otherwise you'll miss out on information and you will keep spending more time in future. So ask anything that comes to your mind with licensing, and I'll be here to help you.
Yeah, because it will be money involved as well, right?
Yes.
So you have to invest to get these things done, right?
Yes. They charge you
That's
around.
why paperwork is so important, isn't it? That's why all this is going to help,
$1,200
because every time you have to pay the fees, right?
True.
That was great listening to you. So keep in touch and let us know what you are doing,
Yes,
keep us updated.
Absolutely.
And now you are on the alumni group, so it's easy to connect, isn't it?
Oh, yes, absolutely.
Yeah.
And
Thank you
in
so
case
much.
you need any more sessions from you, any information, ma'am, I'll be more than happy to take sessions, and it will be a pleasure. It was pleasure talking to our audience, and it was pleasure seeing all of you after a long time today.
Thank you so much for giving your precious time and staying awake so early in the morning for our viewers to know that Dr. Ashlesha was awake since, I guess, 3:34 a.m. just to deliver this talk at around 6. So thank you again. Thank you. Next time we'll definitely try to, match up with your comfortable time as per your time zone.
That's absolutely fine. I'm more than happy to pick up early. My day starts early anyway, so it's not a problem. Whatever suits you all.
Thank you so much. And we'll get in touch soon for our next webinar. Thank you so much.
Thank you so much. Thanks a lot, everybody.
Have a good day. Bye.
You too. Thank you.